Hello, everyone. This is Sara Taub. I'm a pediatrician and a hospice and palliative medicine physician at OHSU, where I also have the privilege to serve as a senior scholar at the Center for Ethics in Healthcare. One of the things that I've found the most heartbreaking during these pandemic times, other than the sheer loss of life and the morbidity, is the realization that there are patients all over the world who are having to die completely alone in hospitals. It pains me for the patients in the beds who find themselves completely alone and possibly grappling with loneliness and fear. I feel for family members who have to live with the guilt and the grief. And I know that it wears on the souls of healthcare professionals, many of whom have had to bear witness to so much loss and do not always feel as though they can compassionately care for their patients under current circumstances. So, what can and should we do when we cannot offer our patients the highest level of care to which we usually would hold ourselves? What is our fundamental responsibility to our patients? And how might we carry it out during times of pandemic when we must also dedicate ourselves to safety and the public good? The concept of professionalism is premised on the social contract that's entered into by members of the general public on the one hand and members of the healthcare profession on the other. In exchange for the trust of patients who come at their most vulnerable, for the privilege to self-regulate, and for a certain amount of status they enjoy in the community, healthcare professionals agree to take on certain obligations. These include the acquisition of a specialized body of knowledge, the duty to develop and uphold standards of behavior, and most importantly, I think, the commitment to serve the medical needs of the individual patient as well as those of society at large. Regarding our commitment to individual patients, I think that as medicine becomes more sophisticated, we've focused a lot on our duty to cure. COVID-19 reminds us that in our role as healers, sometimes what we have to offer the patient is ourselves. They need to know that someone is there with them who will take care of them. I want to share a story that gets to the core of this. Towards the start of this pandemic, when travel restrictions and limitations on visitation were probably at their highest, a woman in Texas was watching from afar as her mother died in an ICU in New York State. She wanted to envelop her mother with love to let her know that she really mattered and that she was not alone. She had no way of getting to her mother's bedside, however, to signify these sentiments. What ended up happening is that the attending in the intensive care unit went into the mother's room with a cell phone and had this back and forth conversation with the daughter and the mother. The attending would ask the daughter, "What do you want me to say to her? How do you want me to touch her?" And then carry out the transmission of language and touch so that even though she couldn't be physically present, everything that the daughter would have wanted to communicate to her mother was being relayed to her in real time. Am I suggesting this is the same as if the daughter had been at her mother's bedside? Absolutely not. However, I think we need to be flexible in responding to the conditions of the world. The standards we hold ourselves up to are the ideals that we know. The daughter at her mother's bedside, holding her hand, stroking her skin, whispering meaningful words, expressing wishes, recalling heartfelt memories. I think what the attending physician was able to achieve here with the creative use of technology is a way to really be present to the daughter and to help bring her to her mother's bedside. Perhaps we should think of this as the good enough standard. The media has focused a lot on the use of tablets and cell phones as a means to reunite families during moments that matter despite the physical distancing. Physicians, nurses, chaplains, or others are portrayed in the doorfront, bringing in images and sounds of loved ones to the sick patient's bedside. I've been struck by the resourcefulness of people across the country and all over the world to restore a sense of humanity and connectedness during these challenging times. Groups have been sewing, crocheting, knitting small hearts, as well as other objects to donate to hospitals. One goes with the patient, the other goes with the family. These objects symbolize the ties that endure, even when people are forced into being apart. They also provide special keepsakes. I've heard of healthcare professionals putting out calls in their community to let it be known that they will be at a hospital at a certain time on a certain date, offering to go visit family members and becoming, in essence, volunteer companions. Within the palliative care community, I'm aware of colleagues who've developed guided journeys with images and sounds that patients and families can listen to together despite being in separate places. The hope is to help alleviate feelings of isolation and really foster a sense of connection. Just to name that our ties to our patients do not dissipate the moment that they take their last breaths, even though sometimes we are pulled away almost immediately to tend to another patient in another room. At some hospitals, I've heard of groups instituting a team pause where just for a few moments, they pay homage to the person who died in the room. Betty loved to have her nails painted in bright red. She couldn't talk enough about her great-grandson. And in earlier times, she loved to share stories of her colorful adventures as a travel photojournalist ahead of her times. Other institutions have incorporated something called next day rounds, where teams still will round on a patient the day after they die, both to honor the individual and to make sure that we are learning as much as possible from the opportunity and privilege to take care of them. Recently, some funeral directors in New York, when they would come to the hospital to pick up the body of a deceased patient, had begun to notice that each body was covered with an individual daffodil. It turned out that one of the morgue workers was procuring flowers at her own expense and covering each body bag with one delicate flower as a way to restore some dignity and some decorum during these challenging times. "The flowers are for the dead alone," the caption in the article read. I couldn't help but think that really this was more a commentary on connection than isolation. I started off this presentation sharing my own inner struggle that patients during this COVID-19 era may feel as though they are dying alone, isolated from the family who loves them and the healthcare professionals who take care of them. Reading around these anxieties has helped me uncover countless small gestures that are being carried out that help restore a sense of humanity. For me, this is a good reminder that despite physical distancing, we can and we must find ways to be present in the lives of others.